So now after we've had a slightly more elaborate nerve, cranial nerve number 5, the trigeminal nerve, now we have a very simple one again, which is called the abducent nerve. The abducent nerve is interesting because it is the other one nerve that only innervates one extraocular muscle. In this case, see if you can deduct the function of the muscle that innervates just from the name, abducent nerve. So it sounds a little bit like abduct, and indeed, the function of the muscle that is innervated by the abducens is to abduct the eyeball from the primary position, so from the forward gaze. And so this muscle is called the lateral rectus. Yeah, and the lateral rectus is innervated by the abducent nerve. And the only thing that this nerve provides is going to be somatic motor and proprioceptive information from the lateral rectus. It's a fairly small nerve as well, and it comes down here from the brainstem. Let me zoom in. Between the pons and the medulla oblongata. See how close we can get? Yep, between the medulla oblongata and the pons. And it'll also traverse the pontine cistern of the subarachnoid space. If we see how long this nerve is, see, it runs all the way over here. Pierces the dura, of course, eventually. But intracranially speaking, it does run the longest course within the cranial cavity of all the cranial nerves. Who would have thought? And something that's actually a little bit more interesting, or should I say important, is that the course of the abducens nerve, we've talked about a couple of nerves and their proximity to the cavernous sinus, right? Well, the abducens nerve actually runs right through the cavernous sinus, okay? Get your bearings for a second. Let me get a little bit closer into the cranial cavity here. The abducens nerve travels through the cavernous sinus. Now, if we were to add back in the veins and everything else, it would get incredibly busy. But the key thing to know is that the abducens nerve travels through the cavernous sinus, so it's basically bathed in this sinus and all the veins that are carrying blood, and it's supposed to flow from the cranial cavity outwards. And in the end, it'll actually exit via ophthalmic veins, and then the angular vein and facial vein, and so on and so forth. The problem is, if you think of cavernous sinus thrombosis, well, veins in the face don't have valves. You can reverse the flow of blood, and that can lead to infections that can spread into the cavernous sinus with that there then the cranial cavity, and then you have a lot of trouble because you have an infection. Often this is Staphylococcus aureus, and that is in the cranial cavity. However, as the abducens nerve is pretty much exposed within the cavernous sinus, this is going to be the first nerve where you can actually find clinical issues. So it will not be able to abduct the eyeball anymore. So someone who has an abducens nerve palsy is going to have a permanently medially rotated or adducted eyeball, because we have the lack of the abducting function of the lateral rectus. So in a nutshell, the abducens nerve only provides somatic motor and proprioceptive information for one extraocular muscle, and that is the lateral rectus. Second, it has the longest intracranial course. Third, and probably most importantly, due to its course through the cavernous sinus, this is the most exposed nerve, and so this is the first nerve, and then with that subsequently the muscle associated with it, that you would actually expect to have clinical symptoms with if you have cavernous sinus thrombosis.